What we say at Port Moody Health in treating cancer generally is we say cancer doesn't work in one way, so neither should we. And that really is such a strong statement for me because cancer is so complex and there are so many facets to this disease, and there is no one cause, and so there is no one treatment that's actually going to be beneficial in treating cancer. And we also have to look at cancer not just as a local disease. So even when cancer is in its early stages and it's localized, so say for instance somebody has a colorectal cancer or a breast cancer and it's localized to that area and there's no lymph nodes involved and it hasn't spread to other organs, we still have to look at cancer as a systemic disease because the cancer didn't start just because of what is going on in that specific area. It's not because of just what happened in the breast. It's not because of just what happened in the colon. It's because there are multiple factors that are influencing that cancer being conducive to its development in that area. So we have to look at what role the immune system is playing. We have to look at what role the environment and toxic exposures are playing. We have to look at, a person's nutrition. And, is their nutrition adequate? Are there areas where we can improve their nutrition or manipulate the diet in a way that's going to help them not just treat the disease now, but also in the long term? And so with this multifaceted approach, where I will often look at strategies that we can pull from either of those directions and combine a treatment strategy that addresses each of those components. And that, I think, is what patients will respond to best, and certainly in my experience that's what we've seen in our patient outcomes. Our patients do very well because we use that combination strategy. And so anyone who's coming in thinking about visiting the clinic, it's really important to understand that this is the approach that we use. It's a different way of thinking compared to what conventional standard approaches are going to be. And they're very disease specific and usually just aimed at treating the disease in one way. Of course, with immunotherapies, we're starting to look at now, these drugs called immunotherapies that do engage the immune system. But again, if we just focus on the immune system, we're missing the whole big picture. And it comes back to treating cancer as a systemic disease. We've got to nail the other components if we really want to be successful in our treatment and achieve overall survival and best health too.